Okay, morning everyone. Welcome to the virtual session on how to use the OTC Online Medicines Directory Toolkit. Thank you for taking the time out of your morning to attend the session, and we are hoping that you're going to find this session quite beneficial. Please note, as you can see, all of your mics have been muted during the presentation. They will be enabled during the Q&A session after the presentation has been completed. In terms of house rules, as I said, your mics will be muted, but you can post your questions on the Q&A platform, and your mics will be enabled during the Q&A session. My name is Melanie Govindasamy, and I am the Acting Comms and PR Manager at SAHPRA. My colleagues and I will be taking you through this training session. I'm joined by my esteemed colleagues, Ntokozo Msiza, who is the SAHPRA web designer, as well as Nicola Brink, who is the Chief Executive Officer of the Selfcare Association of South Africa. As you know, we launched the OTC Online Medicines Directory last year, and we've already received global recognition for it, and we are super proud of this accolade. It was also even mentioned during a session in Parliament. So on behalf of Dr. Semete, our SAHPRA CEO, we really ask for your cooperation in getting the word out that this dynamic and useful directory actually exists. Nicola, would you like to come in and reflect on the long-term vision of this initiative?
Yeah, with pleasure. Thanks, Mel and Ntokozo, and welcome to everybody online. I see we've got a really good session. Yeah, as Mel said, I mean, this particular directory is what we've called phase 1. And phase 1 is schedule 0 through to 2 of category A medicines at this point. Category D medicines, when they are registered, will obviously be included. Phase 2, which we've already started, will include schedule 3 and above. So as Mel mentioned, this is receiving global accolade, global recognition, and global interest. We've had several requests from other countries to keep us in the loop, to let us know how we progress, because there are a lot of plans attached to this particular online directory. The long-term vision, and please, I do stress that it's long-term because there are a lot of hurdles and obstacles to overcome. The long-term vision, however, is to do away with every single piece of paper within the pack. So basically the PILs and PIs, and to have a QR code, or maybe even, and I have a meeting on this on Monday with GS1, maybe even being able to direct it through the current 1D barcode. But the idea is that there's this one central spot with all information. It's controlled by SAHPRA. All the information is correct, and it becomes a one-stop shop, if you like, for both the healthcare professional as well as the consumer stroke patient. So as Ntokozo said, we'd be really, really appreciative. In fact, this said, it is mandatory, but Mel will come to that in a moment, for your participation, because without the consumer or the healthcare professional knowing about this platform, it's pretty useless. There are other plans to include other vernaculars in time, to include audio and so forth. So really, we're the first in the world. We're hugely proud of this, and we ask that you give us your full support, not only SAHPRA, but industry as a whole, and our country. You know, we don't often have things we can shout from the rooftops about in this space, but this particular initiative we certainly can do, and we ask that you partner with us on this journey. Thanks, Mel.
Thanks, Nicola. Ntokozo, presentation. Okay, in terms of the purpose of this online medicines directory, it's to provide patients, consumers, and healthcare providers with a single trusted source of information for all medicines approved by SAHPRA. Can you see the presentation?
Not yet, Mel.
Okay, let me try. Okay, there we
Yep.
go.
See it, Mel.
All right,
Thank you.
perfect. Yes. Great. So moving to the next slide. The website currently has approved patient information leaflets as well as professional information in English. One of the key things is, and it's important to note, is at no point will any promotional content be permitted, nor will this website ever be commercialized. Tokosi, you can keep pressing yes. And the third and very critical aspect is that in terms of access, we are trying to work towards making the website zero rated, meaning you will not require any data to access this website. We want everyone across all communities to have access to this information. Hence, our drive to make this a zero rated website. So this specific toolkit, what does it offer? Firstly, it provides essential creative guidelines and resources to help you customize your various collateral or your platforms so that what we're aiming for is consistency and alignment across all of your materials. And we need that so that when users or any type of consumer or healthcare professional, when they access this or when they have view of it, there's consistency and awareness of what the OTC online directory is. We're also providing you with a visual identity to messaging guidelines. So this will allow you to have the necessary tools to increase the awareness of this directory. So Nicola, you want to come in and speak to phase 2 of this initiative?
Yep, thanks very much. So I did allude to this earlier, that phase 2 has commenced, and what we will have is, and this, please, this is just a mock-up, it's not the actual. We'll have an OTC section, and then we'll have a prescription section. So you'll be able to click on one or the other. At this stage, there will be no password protection on the prescription. That may change, but for now, Dr. Sameta wants it to be open. And as I mentioned earlier, it's really, really imperative that you start talking to both the healthcare professional and to the consumer stroke patient about this site, because honestly, it's useless without people knowing about it. When I have several healthcare professionals in my family, and when I show them what we've got and what we've done so far, they're totally blown away. Really, this is an incredible resource, and we do encourage you to participate. Thanks, Mel. Mel, you muted.
Thank you for that. Okay, so you may be asking, is this mandatory? And yes, using the artwork that we're about to share with you is indeed mandatory. We're not going to be unreasonable, so we don't expect you to completely remove your current existing materials that you have for your products. What we would like is that it should be applicable moving forward in terms of your packaging and things like that, and making sure that OTC online directory information is on your various collateral. Okay, so this bit in terms of the creative guidance and key visuals, and Tokozo will come through. He's going to give you key information in logo placements, in terms of use of colors, to various font usage across the collateral. If you have any questions during this part, please pop your questions on the Q&A platform. Over to you, Ntokozo.
Thank you, Mel, and good morning to all our attendees. As Mel has indicated, This section will speak primarily on the guidance on how to use the visuals associated with the OTC brand and the site and the CI thereof. So below is the primary logo for the OTC directory. And this logo must be added to all the brands and creative and marketing assets. So this is primarily the marketing material that you will be using, and also the product packaging that you will be using on for your products. SAHPRA's ask is that you add all these materials, promotional material, as far as possible, whether a detail aid, a Facebook post, print ad, website, or on e-commerce website, and we'll touch on e-commerce website in a bit. So the question that we received once is that will the logo be provided? Will the artwork be provided, or do we need to create your own? The short answer is that no, we do not provide artwork. So what we do provide is the logo itself. The marketing material that is to be used in association with the logo is to be developed by you, and then you can request the logo using the email address that's on screen, which is otc-artwork@sahpra.org.za, and then we will send you what we seek for you to proceed. So if you can notice, the OTC brand and colors were derived from the SAHPRA CI. And the call to action it goes hand in hand with the icon that's on the left. So the get information heading is simply what the OTC site is about. So it's about getting information relating to products, over-the-counter products from Schedule 0 to 2. Note that when the directory moves to all medicines, without prescription will be dropped. It simply means that when we do add more schedules, then that section that says without a prescription will be dropped from the logo itself. And then the third tab there says that this is the URL to the homepage of the online directory, which is also found on our website from e-services. There is currently a campaign that we are running related to e-services. So if you head over to our social medias, you might just find out how to access it and also what the OTC site is about. All right. So in terms of how to use the logo, the placement of the logo needs to follow certain guides. Right. So it always needs to be on if you're going to use the original colors of the logo, it needs to be on a white background. And these are the type of examples or type of placements on how to use the logo. Okay. These are other variations on how we can use the logo. The logo can also be utilized with a dedicated QR code. So we have our QR code, which when you scan it will take you directly to the Meds Info site, the URL that's displayed on screen. And you can use this QR code instead of using the icons of the logo when placing on marketing material or promotional items. You can also use the logo in black and white. We have had some questions that when it comes to printing on products, on packages, it might be more expensive to use the SAHPRA, to include the SAHPRA logos on the current existing colors of the brand. So for any other brand that's out there, if you want to also incorporate SAHPRA logos, it may kind of be expensive as well. So we do allow this specific logo type to be used on your packages. So you can use a black and white variation. And same as as I explained with the QR code, when you scan it, it does take you to the Meds Info landing page. And this can also come in black and white format. Okay, this is an example of the logo displayed on a white background, on white and a colored background. Yes, this is another variation of how we can use the logo. If you can look at the bottom left corner, bottom right corner, sorry, you've got it looks as if it's a social media post, and this is how we request the logo to be used. So if you look at the bottom right corner of the artwork itself, it has the get information logo with the polls. Our font for the logo is Poppins font family, which is the font family that is used on our website, on the SAHPRA main website, as well as on the OTC subsite. These are our colors, corporate colors. You find them in RGB, CMYK, HEX, and on request, you can also request for Pantone colors. All right, section 2 covers market authorization, holder activation guidance. This is addressed to all the market authorization holders. SAHPRA calls on all market authorization holders to include the OTC directory activation on your brand communications nationwide. Mandatory activation includes the following: brand websites, brand pages on e-commerce websites, brand social media where multiple tiles are possible, brand point of sale material, brand healthcare provider material. So we urge and ask you to please help us make this site go to site for consumers and healthcare professionals alike. Please, please, please work with us. When placing the logo on your website, you can use the logo, and you can also change the URL at the bottom. So if you go to the OTC site, right, and you go to companies, you can go to find a list of companies, and each company has its own URL, and you can place that URL under the where it has the URL of the brand's info at the bottom there. So as we explained before, you can have the logo with the pills. You can have your own QR code, and you can have a QR code that has your logo as well. And all of that goes hand in hand with your URL that goes to the company site, company landing page in the OTC site.
And
An
Koza,
example
it's
of how.
Nicola. Sorry,
Hi,
it's
Nicola.
Nicola. Can I jump in for a sec?
Of course.
Please. Yeah. Hi, guys. So just a quick one on that. In terms of the QR code, each individual product has the ability in the back end, or there's the ability in the back end to create a QR code for each individual product. So for example, if you are, let's just say, we'll just use an arbitrary product X, and if you want this particular QR code to go directly to your particular product, you just then insert that particular QR code, which you generate in the back end, onto this artwork. Thanks, Ntokoza.
Thanks, Nicola. The next section covers how to use the logo on your website. So this is an example. So I just have to mention that the majority of the artworks that I use in this presentation are mock-ups, and it's just an example of how we show you how to use the logo on your site. So this is a slider from and it shows you when you have a slider on your website, you can have your slider, and at the bottom right corner of your slider, you can place the logo. Obviously, the logo doesn't necessarily have to have a QR code because you're already on the site. So we can just have the logo there, and when you click on it, it can take you directly to the landing page of the product or the landing page of the OTC site. This is another section. Maybe you can use it on a call to action within your site, where you have your call to action, and then you can have a picture on the site on the right hand side or on the left hand side, and then on the bottom right hand side of your banner, you can have the logo as well. So on the products page of an e-commerce site, as an example that's displayed here on the right, you have your product page, and generally with product pages, you've got your sorry about that, you've got your product, And then you've got your standard items that go on the product, your product page, like your add to cart, the description of your product, the product quantities, and so on. So generally, we then ask that below your description, you can add a link that goes directly to the product information on the OTC site. I've seen with a couple of pharmacies on their e-commerce sites, they do have a link of products. So, for example, if you're on a paracetamol product and you just below the description, you can have a link that goes directly to the OTC site product page where you get the information like the PI and PIL. You get the dosage, you get the how to use the usage, and so on. For social media, this is an example, sorry, of an Instagram post. The primary brand link needs to be displayed at the end of the creative, and included within the post copy as a call to action. So if you have an Instagram post here, for example, you can have your post as is, and in the bottom right, you can have the call to action that says that has the information about the OTC. And just below there, you've got the Instagram post, which is an example. You can have your write up, your description, and then you can have the hashtags. These are the hashtags that we use. Sorry, these are the hashtags that we use for OTC. And the call to action, when you click on it, can go to the OTC site. I know with Instagram it doesn't allow you to necessarily click on the link. So what we normally advise people is that you can have the link in your profile or in your bio, and then you can just use a phrase like refer to bio for link. Okay, and then here we've got an example of a generic brand point of sale stand with a wobbler. So we've got our products here, and within the products, there's a wobbler that has the QR code, and that's got a short call to action that when consumers scan the QR code, they can be redirected to the specific product of the OTC on the OTC site. Another one is a leaflet or a flyer that can be used when sharing your brand material or marketing material. You can also include the logo with the QR code. Another example that we urge, especially pharmacists or anyway by the cashiers, we have maybe like an A1 poster that has the call to action that also has the QR code. And when you scan the QR code, it'll take you to the homepage of the OTC. There's also a poster just where the pharmacist is assisting a client or a patient. They have a poster just next to them where they can scan the QR code, which will then take them to the OTC landing page. Thank you so much for your time, colleagues. I'll hand over back to Mel. Thank you.
Thanks, Ntokozo. That was very detailed. I think there's a question on the Q&A platform. The presentation deck, as well as this recording, will be available on our website. It will probably be available either by the end of today or early tomorrow morning. Ntokozo, you're going to open mics. Let me see what other questions are on the chat platform. Yep. Okay. So
Mel, I can help you with the first one.
Sure.
All right. I think you should open the training to all ad companies. The invitation was extended to all advertising companies. We asked all members of the ITG and various other industry associations who participated in today's meeting to please send the invite to advertising agencies. Whether that happened or not, Connie, I don't know, but that was the ask. And we'd always be happy, or I certainly would be happy to take any advertising agent through this if that is helpful. Thanks.
Thanks, Nicola. Connie again, when is the mandatory use of the logo on artwork? I think it should be immediate because since we've had the training, I think it's important that moving forward, you start to incorporate all of these visuals either on your platforms, meaning your website, or your product packaging. I hope that
Mel,
answers your question.
If I can
Sure.
add to that. This toolkit was shared last year, so it's been in the public domain for close on 6 months, Connie, and in it, it's very clear that it's mandatory. So no, there is no roadmap. I guess we could SAHPRA could put a communication out to say it's immediate, but as Mel said, nobody's going to be unreasonable. And Dr. Samete was very clear that if there's existing material out there, they don't expect you to pull it, but they do expect you to have adapted your artwork, certainly by now. But if for some reason you didn't find the toolkit on the SAHPRA website when it was loaded probably 6 months ago, you need to please start indicating or showing SAHPRA that you are taking this seriously and that you're changing your artwork. Thanks very much.
Thanks, Nicola. Also, Connie, this was communicated as Nicola explained. It was placed on the website and there was also a communication sent to ITG. So all of this information has been in public domain for a while.
Mel,
Yes.
can I just ask that if you do want to raise your hand and you want to ask a question verbally, please just raise your hand and we will acknowledge you. And then you can ask your question. You're not limited to the Q&A. If you do want to discuss with us, then you're more than welcome to just raise your hand and we'll acknowledge you. Thanks.
Okay, I'm just going to go from the top. Will this apply to category D medicines? At this time, not as yet. Nicola, am I correct?
Yes, that's correct. I did mention in the when I spoke earlier that this is for SAHPRA registered approved products, and there's not a single complementary medicine on as yet that's been approved. As soon as they are approved, they will automatically you will automatically be required to load them. We're working with SAHPRA to have some sort of timeline on that. So you will be, through the various industry associations and through SAHPRA's communication, be alerted to when that process will start. But yes, long term, certainly will include all of them, but for now, not until they're registered.
Thanks. Nicola. Lynette's asking, will SAHPRA be providing standard posters that may be downloaded and printed? Not at this time. We encourage you to continue working on your various product pages or platforms to actually use our current visuals that we will be sharing. Thank you, Kirsty. Yes, agency.
Sorry, Mel, can I add to that? Lynette, if that is a huge, if that is an ask, the Selfcare Association would be happy to put something together, but we need to understand that it's going to be used. My previous experience in marketing is that most companies will want to do their own, but certainly maybe you could touch base with me offline, Lynette, and just let me know if that is an ask, and I'd be happy to do that myself. Thank you. Thanks, Mel.
Thanks, Nicola. Kirsty has acknowledged that agencies are attending today. Thank you, Kirsty. Paul is asking, will SAHPRA share open files of the logo?
Yes, we can, Mel, but
yes,
and that is via that website, that email address, OTC artwork. Paul, if you require that, just drop an email, and those open files are available. It's just a matter of I guess sending you the link because they're huge, as you can imagine.
Yes, correct. Thanks, Nicola. So Merle is asking how and who will enforce mandatory application of this if it's not in the act or regulation.
Sorry,
we
where's okay.
it's
Yeah,
small.
guys, y- work with SAHPRA. You know, you can always find a loophole as to why you can't do this, but please think of the long-term vision and what you'll be saving if you don't have that piece of paper in pack, or if that piece of paper is limited, or whatever the case might be. So please work with SAHPRA. You know, where you start looking for loopholes not to participate, it's not going to be taken in a positive light from SAHPRA. So yes, there is nothing in the Act, but it's as far there are several things that are not in the Act that SAHPRA makes mandatory. So we ask that you please work with SAHPRA, not against SAHPRA. I'm also going to answer the other one, Mel. There's a question that says there was mention of phase 2 incorporating video content and infographics. In light of the site being non-commercial, are you able to expand what this would look like? Not at this stage. This is part of the plan eventually. When we first started this, and Dr. Sameta mentioned that there's a lot of scope and opportunity, but we've got to get the basics right first. So, and when you say it's not commercial, it means that nobody will be receiving money to host product. So this is not a MIMS. Nobody will be charged to access product and so forth. So for now, unfortunately, we don't really have the detail. It's just part of the long-term plan.
Okay.
Elizabeth, can you expand? Will we have to upload to the SAHPRA repository and toolkit? I don't understand your question. Elizabeth, would you mind coming on and just giving us a...
Because our mics enabled?
Hi.
Yes.
Yes. I just want to know, sorry, I'm not up to date with this OTC medicine toolkit. I know that it was shared already a while ago, but I just want to know, do we have to share the information because we have to, after a product has been registered, we have to send the PI and the PIL to the SAHPRA repository. Is this platform going to be in conjunction with that? That we have to have all the same information? Well, it will be the same information because it's going to be the latest approved one.
Correct. So just treat the two as separate parallel processes. So in terms of the OTC on directory, each company has their own backend, and the responsible pharmacist goes in and loads the appropriate information. So it's quite, all the guidance is very clear. There's another training session on the 4th of April if anyone wants to join that. But yeah, they're two separate processes at this point.
Okay, wonderful. Thank you, Nicola, for the clarification.
Sure. There's a thing, can you include Pantone colors? Yes, we'll make a note to do that. Mel, you and I, we can do that via the email address. So Prakash, if you can just drop an email, and obviously this detailed presentation will be shared shortly after, and you can pick up the email and you can ask for the Pantone colors and those will be sent to you. Oh, sorry, you've already answered that.
Oh, sorry, I'm muted again. So I'm just scrolling to the top. Will the directory replace the PI and PIL repository? Ultimately, yes. We're trying to move away from use of paper, and hopefully long term is for that little piece of paper in your packaging to be removed, and for patients and HCPs to access the directory for your PI and PIL information.
Mel, just to add on, if
Sure.
maybe they were asking about the repository that's on the SAHPRA site, then the answer to that is yes as well, because at the end of the day, it will be duplicate of information. So whatever information that's on the OTC is also on the PIL repository, which doesn't make sense. So yes, I think we will be moving towards the OTC completely. Thanks.
Okay.
I'm going to take Taryn's one. Are there examples of what has already been executed? Taryn, we're not marketing we're not pharma companies, so no, I don't personally have anything. We can certainly ask and see if we've got something out there. I'll make a note of it, and if we do, we'll try and make that available.
And can I
and
also
also,
just
can
jump
you
in there?
take? Yeah, yes, please do.
So for as an example for e-commerce sites, if you go to the Dis-Chem site, you'll see that some of their products does link to the OTC site.
Yeah.
So if you want an
Correct.
example of how an e-commerce works for the OTC space, then just head over to Dis-Chem as an example. Thanks.
But just to add though, that Dis-Chem doesn't have what we want. Dis-Chem takes you to the landing page of the OTC directly.
Yes.
What we want is you to take it. We want access. So let's just say, for example, Iliaden is being sold on a particular site. The QR code or the URL to Iliaden should be on that site. Whereas Dis-Chem at this point in time, and we have been talking to them about this, at this point in time, they just have a URL taking you to the actual site. You've still got to go and, as a consumer, dig in and go and find the information.
So this is Taryn. So thanks for answering my question. I think it is a good idea just to get a couple of examples because I think a lot can be open to interpretation. So even though you've shown us what the examples could be in a context on an Instagram post, on an A4, on a packaging, there are variations. And you know, if we there has to be a guideline as to how we execute it that's going to create the least amount of not risk, but the least amount of, because there's a lot of things that we would need to change based on what the request is. So an example or a guideline would be very useful because then at least we're not interpreting what we think it's going to look like, and we've got a very clear guideline of how we need to execute it.
100%. Taryn, are you
Thank
from
you.
an agency or company?
No, I'm from a company. I'm from Adcock.
Okay, thank you.
Thank you.
Good point, Taryn. We can certainly put something together. Also, Nicole, I see your question, and absolutely thank you for that. If we can just clarify that this applies to promotional material, websites, Instagrams, social media. It's not your packaging. So you're not changing the packaging of your pack. I hope that is clear.
Thanks, Nicola.
We're just going through open files. Yes, we've already. I'm just going to go from the top and just see if we've missed any.
There is one. Is upload onto the platforms done as a single product application per strength? What happens when there are multiple strengths on a single PI/PIL? Would it have to be separated? And I think they're referring to Schedule 3 or 4.
Yeah, but even on Schedule 3 and 4, don't worry about that now. That is being addressed, and that we're very well aware of that. But this particular training is for OTCs, and we've catered for the fact that there could be multiple applications. So please disregard that for the moment. It's not applicable to OTC, but it is being handled on a from Schedule 3 and above. Okay, we've got here, please advise how we should apply the logo if we already have our company brand CI in place that has taken the bottom right space logo placement. Yeah, good question. And to Khoza, have you got an answer?
Yeah, I can jump in here. And I think all companies have got their own CI and how their logo placement should be. So there are exceptions that obviously we can make. And obviously there has to be a discussion. So you would have to send us an email saying that, okay, we want to participate or practice in putting the OTC site on our marketing material, but we already have our own logo on the bottom right corner. And then we can then start having a discussion on how we can then move ours to a different section, because obviously your logo needs to take precedence on your marketing material. So it is something that we need to discuss first. And obviously, if we haven't discussed it, then we do suggest that you place our logo at the bottom right corner. Thanks.
Because I just want to come in. I think maybe that's what Taryn was talking to in terms of variations. So maybe we can discuss this offline in terms of how we would have to look at different variations to accommodate the various, collateral that current companies have.
Yeah.
Okay.
Fair enough. Angelica, you've asked when can we start replacing the PIL? I'm not clear on that question. Are you meaning that we, in other words, take it out of the pack? Angelique?
You can.
Okay, I'm
Your mic
assuming that
is-
that's what you mean. Are you online?
Sorry, I'm
Angelique?
just busy. Yeah, I was just busy unmuting. So, Nicola, you
Uh-huh.
mentioned that the plan is to replace the PIL with the QR logo. When will
Correct.
that come into play?
Okay, so we've got a meeting on Wednesday with SAHPRA, with the think tank, and there'll be a pilot to start. It's
Okay.
going to be a while. Angelica, we've got to zero rate the site. We've got to have everything in place. First, the consumer needs to know about it. The doctor needs to know about it. So the more companies that come online as soon as possible in terms of promoting this site, the quicker we will get to that place. But you can't do it now if nobody even knows about the site. So, it's a process, and this is the first step.
Okay, no problem. Thank you.
We have a hand, but it's an unknown user. Would you like to introduce yourself?
Hi, Melanie. This is Yusuf from Usman Biosims. How are you?
Good. Thank you for
Good,
your
good.
participation.
Good. Just a question, Melanie. I know that the eventual outcome of this initiative, and I really do support it, is going fully digital with regards to PILs and so forth. I'm just playing devil's advocate here. In South Africa, not everybody has access to the internet or to electronic media, etc., social media, and so forth. How will that impact this initiative, if at all?
I'll answer that. I'm going to answer that if you don't mind. We're
It's
very,
okay.
very well aware of that. And there is the Selfcare Association is driving this, and we put a white paper out quite recently to SAHPRA. Those are all hurdles that we need to overcome. We have strategies in place. We have plans in place. It's a long-term initiative. This is not going to happen overnight. This is probably a 5 to 10 year process. And we acknowledge exactly what you've said. And therefore, but we have to start somewhere. And this is where we're starting now, is to have this site with every single product. And I see somebody's asked, is Schedule 2 medicines also included? Absolutely. Go and have a look on the site. You'll find all Schedule 2s there. And if your products are not on the site, you need to get hold of us ASAP, because somewhere you've missed out on critical information being shared. I'm going to also take this one. If we have not received any communication on the SAHPRA toolkit, please can you share with us the relevant contact people? If you go onto the SAHPRA website right now, and it's been there for about 6 months, if you go and have a look under the e-services, scroll down, you'll see toolkit, you'll click on it. All the information that you need is there, including the relevant people at SAHPRA to contact. Hope that answers your question.
Viba is saying he's not received any communication on the SAHPRA toolkit.
It's on the website. You should have.
It's on the
Do you belong
website.
to?
Okay.
Yeah, I've answered that one. I'm not sure.
Okay.
You obviously don't belong to an industry association, Viba, or check the SAHPRA website regularly, but you should have. And I'd be really interested to know why you haven't. Why somehow you've slipped through the cracks. But if you go onto the SAHPRA website, just search toolkit and you'll find it. Turnaround, Jackie. What is the turnaround time for inquiries? It's a difficult one to say. We'll try and get to you ASAP. If it's just artwork, it can be almost immediate. But between myself and Tokoza and Mel, we'll endeavour to answer it as soon as possible. but I'm not going to commit to an absolute timeline, but it'll be, I think you'll be pleasantly surprised. There's also medical devices. Not for now. There is no plan to include medical devices yet. And it's largely because there are so many. There are thousands and thousands and thousands and thousands, as I'm sure you can appreciate, Lizelle. So for this, at this point, no, there is no plan, but that could change in the future. Just going down to see if we've answered all the others.
I'm trying to go through as well.
Sanjay, I think this has been answered, but will the directory replace the PI and PIL repository? Ultimately, yes, ultimately it will, but not for now.
Okay.
If I can answer the question, can we clarify that artwork in this context means artwork for promotional material and not artwork for product labeling? Yes, absolutely. I think Nicole also she did bring that up. So yes, it's not for your carton or your PIL. Thank you.
Nicola, there's a question here. I'm not too clear. It says, in line with the present regulation and promotion of information of Schedule 2 medications to the public, please explain the rationale of this. When you say rationale of this directory, Mpo?
I can answer that. So basically, you're saying that Regulation 42 doesn't allow the advertising of Schedule 2 products. You're absolutely correct. It doesn't. But because this is a SAHPRA site, this is the regulator. Both SAHPRA and ourselves have obtained legal advice to say that it's perfectly permissible for the regulator to make this information available. It is not promotional. It's not trying to sell one product over the other. It's not, there's no incentive for the consumer to choose a particular product. And there's no formulary. It is just information. And so as much as I appreciate your question, the answer is no, it's not a violation of Regulation 42 at all. And boys, is that pretty much what you're asking? Just going down. Okay, Viba, we can ask SAHPRA to send out again, but I'm absolutely gobsmacked that in the last 6 months you haven't received, and I'd really love to know why, because that maybe is a gap that we've missed. And I'm going to put, if you go on to the site, you'll see my email address onto the Toolkit site on SAHPRA. Why don't you drop me an email, and I'd really like to try and to get to the bottom of this, because it's not fair that you didn't receive information, and I'd like to rectify that. So please do drop me an email. Or if you can remember, it's Nicola, Nicola, at selfcareassociation.co.za, and I'd really love to help you.
We'll just share the presentation just 1 second so they can have a look at it.
Okay.
Because
all right, you've asked how will the consumer be aware of this in the first place, Mpho? That's the whole purpose of this particular training session. We're asking for you to do that for us. SAHPRA does not have the resource to promote this to the consumer. You are already going to the consumer on your products. You're telling them about your products. You're also going to the healthcare professionals. So there's nothing stopping you from asking the healthcare professional to tell the consumer. So that's the whole purpose, is to say, please help us help you to get the consumer to be aware of this. I think that's all of the questions. Is there a question perhaps that somebody has posted that we have not addressed? Could you raise your hand if there's a question that's not been addressed, please? Could you raise your hand if there are any additional questions? Camille, I'm going to jump in and then hand over to you. So guys, thank you. I mean, hopefully in years to come, this will be so commonplace that everybody will know exactly where to put their products, where to
Hello?
put this. Yeah, I
Is that
see.
a question
Sorry, I
from
had
Paul?
Yeah, I
question
do see that. I was just going to finish my sentence, but let's take your question,
Sorry.
Paul. Okay,
We
Paul,
don't
please.
have. Can you hear me?
Yes, Paul, go for it.
Okay, we asked the question regarding the font. Should we not have the pop-in font? Can SAHPRA give us like 5 alternative fonts that we can use as applicants?
Kosa, that's yours.
Yeah, so I'm not sure if you saw, I answered the question, and I said the Poppins font is primarily for our logo. We can't dictate what font to use on your promotional items. So it's for our logo, and we can't say every promotional items must use Poppins. I hope that answers your question.
Does that answer it, Paul? So you can use your own font that you're using for your particular promotional item, but the
not
actual
for our
logo,
Yeah.
the actual logo being put on there will have the Poppins font.
You still have your hand up, Mpo?
And,
Yeah.
oh yeah, thank you very much. You have addressed my question.
Thank you.
Okay, perfect.
Sure.
Yolanda asks for the link. Yes, everybody on this call will be sent the link via email, and Tokoza, that's correct. After the
Yes.
For
this
the recording.
presentation. Yeah.
Yes, for the recording and the presentation. Yes.
Yeah. But you will always find it on SAHPRA's website in any event. If you go down to events, you'll find it there.
Yes, that's correct.
Right. Elizabeth, thank you. It's always lovely to get a thank you and a praise. We normally get the negatives, and I do appreciate why, because change is not easy. So I really do appreciate you saying thank you, because a lot of work went into a lot of time and effort. So thank you. Yes, Merle, the open files, that's already been asked.
Yes.
We will, if you need the open file, you just need to drop SAHPRA a note on that email address, and that can be shared. They're obviously massive, so it would have to be some sort of WeTransfer. We are reluctant to put them all onto the website for obvious reasons. It was considered putting all the open files onto the website, but we thought it would be better and more prudent to just handle it on a case-by-case basis. So, Merle, if you do need an open file, please drop SAHPRA on that. You'll see OTC artwork on the screen as we speak, and you can just drop us a note on that. Anything else?
Just responding to. I don't think so. A new post, let's see. If consumers don't have access to Schedule 2 medicines in the pharmacy, where will they get the information?
I don't understand your question.
Understand the question. Paul, what do you mean by that?
Oh, wait, I think I do get it. We're not currently advertising a Schedule 2 to the consumer. Yeah, good question. So basically what we working with the big pharmacy chains to put information up in their pharmacies about the particular site. So that's a very good question. Thanks, Paul. We're not allowed to advertise Schedule 2 to the consumers. So where will they get the information? They will get the information through the Schedule Norton 1 promotions, and also in pharmacy we can tell the consumer where to find information. So some sort of basic call to action, if you like. Lynette, thank you for the thank you. Always do appreciate it. Guys, and please, you can see my email address, you see Mel's and Tokoza. If there's a question that you didn't think of right, or that at this moment, and it comes to you a bit later, please do feel free to drop us a line. Honestly, we're here to help. We're really, really super excited about this particular initiative. Honestly, it's just, yeah, I've seen the emails that have come through from global counterparts, and it's so encouraging. And and you kind of a little bit smug and smile broadly when they go, "How on earth did you guys get this right? Your regulator is just amazing," and they are. And so Mel and Tukoza and Dr. Smetu, who wasn't able to join us today because she's traveling, she's been amazing and so forward thinking and so accommodating and visionary. So I do thank SAHPRA and thank all of you for participating, and in advance, thank you so much for supporting this initiative, and we do hope that you will support it, and that if there is any reason that you cannot, that we'll be able to overcome that hurdle with you, and provide the direction you need so that you can participate. One last thing, if there's any company on this call whose products are currently not on the OTC directory, please reach out. We need to get you on there. It was our understanding that everybody was on there, but please reach out. So I'm going to switch my camera off and hand over to Mel to wrap up, and wish you all a very pleasant Thursday, and look forward to seeing the OTC online directory communication out there. So thank you, everybody.
Thank you so much, Nicola, for your support and your participation today. Colleagues, thank you so much for attending. I know, you've got busy schedules and you've taken the time to participate and ask really engaging questions. So we encourage you to continue asking questions, because we want this OTC online directory, as Nicola said, to be out there for consumers to have access to this information and to be aware of this portal. So thank you so much again for your participation. Make sure to please contact us if you have any further questions, and I hope that this session has been beneficial to you, and I look forward to hearing from you. So thank you so much. I think that's it from our side. Wish you all have a wonderful day and week ahead. Thanks.
Thanks, guys.
Bye.
Take care. Thanks, Mel.
Thanks, everyone. Bye-bye.
Thanks, Nicola.
Thank
Bye.
you. Thanks.
Bye-bye.
Mel, can we touch base just after, please? I'll give you a
Sure.
call.
No problem.
Thanks, everyone.